Welcome to session A for the town hall on guidance on PFAS testing and health outcomes. I'm Liz Boyle from the National Academies, and I'm here with Ned Kalange, our committee chair.
Hello, everyone, and welcome. I'm Ned Kalange. I'm the president and CEO of the Colorado Trust, and my academic appointments are in the Colorado School of Public Health and the Department of Family Medicine in the Colorado School of Medicine. The study that we're talking about today is being conducted through the Board on Environmental Studies and Toxicology, Division on Earth and Life Sciences, and also by the Board on Population Health and Public Health Practice, the Health and Medicine Division, and I am the current chair of the Board on Population Health and Public Health Practice. I wanted to tell you what we're doing today. This is a recording to outline the PFAS pre-town hall session. I'm going to provide some some background information on the National Academies. And then Elizabeth is going to give a review of the PFAS guidance study statement of task and talk about our study plans. Just a little bit about the National Academy of Sciences. The academies were started by President Lincoln in 1863 when the charter of the National Academies of Sciences was accepted. I think a great way to talk about the guiding North Star for the Academy is that the Academy shall, whenever called upon by any department of the government, investigate, examine, experiment, and report upon any subject of science. Things have evolved since 1863, and the National Academies are now the National Academies of Sciences, Engineering, and Medicine. Today, the academies serve a dual mission. The primary mission is to serve as an independent scientific advisor to the nation through our operating arm, which includes 7 divisions and 60 boards. But we also have a mission of honoring top scientists through the National Academy of Sciences, the National Academy of Engineering, and the National Academy of Medicine. There are things that the National Academies are not. We are not part of the government. We are not an advocacy organization. We're not consultants to for-profit entities, and we don't have research laboratories. A little bit about the consensus study process that this town hall is informing. We start at one end by defining the study, including a statement of task, which Elizabeth is going to cover for this PFAS study. Once the study is defined, there's a nomination and selection process for the committee members. Then we move into the heart of the study process with committee meetings, with approaches to gathering information, to deliberations on that information, and drafting a report. Once the report is drafted, it moves into review and then eventually release. As soon as we start meeting all along the path, we're meeting with the communications folks at the National Academies to talk about the dissemination and uptake of the report once it's done. And then at the end, when the study is ready, that is communicated and distributed to stakeholders who can implement or act on the recommendations. Throughout the study, we gather input from stakeholders all through the process. And town halls, like the one this is previewing, is one of the methods for the study committee to receive input from our stakeholders. There are 2 different kinds of meetings in a study section: meetings that are used for information gathering and meetings that are used for committee deliberation. Information gathering sessions are all publicly posted and advertised. These sessions are required when committee members meet with people other than staff. And that includes the study sponsors. So whenever we meet with study sponsors, that is an information gathering meeting. Any information provided to the committee is also made publicly available. On the other hand, committee deliberation sessions are an important part of the process. These sessions are where committee members discuss ideas, learn from each other, and work towards consensus. There is a special section of the Federal Advisory Committee Act to allow for closed sessions at the National Academies meetings in order to support deliberation. In terms of information gathering, we have strategies such as workshops, other meetings, and town halls. We can also gather information from commissioned work. Any information provided to the committee by anyone other than Academy staff or their fellow committee members can be available to the public. I'll turn things over to Elizabeth to discuss the statement of task.
Thanks, Ned, for that background on the National Academies. So the statement of task for an Academies consensus study is the scope of work that is included in our contracts with the federal government. And committees cannot go beyond the statement of task, and they also need to sufficiently address the statement of task. So the statement of task is really important because it dictates what the study will and will not do. And so the statement of task for this study says that an ad hoc committee appointed by the National Academy of Sciences, Engineering, and Medicine will consider current evidence regarding human health effects of the most widely studied per and polyfluoroalkyl substances. The National Academies will provide the Centers for Disease Control and Prevention and the Agency for Toxic Substances and Disease Registry and the National Institutes of Environmental Health Sciences an objective and authoritative review of current evidence regarding human health effects of those PFAS being monitored in the CDC's National Report on Human Exposure to Environmental Chemicals. The National Academies will also provide recommendations regarding potential changes to the CDC ATSDR PFAS clinical guidance, including options and considerations to guide decision-making for PFAS testing in a patient's blood or urine, PFAS concentrations that could inform clinical care of exposed patients, appropriate patient follow-up, and care specific to PFAS-associated health endpoints for those patients known or suspected to be exposed to PFAS. The information will be used to inform how communities and individuals exposed to PFAS could be best served by clinicians. So specifically, the committee will undertake the following tasks. Will assess the strength of the evidence for the spectrum of putative health effects suggested by the human studies, to establish a basis for prioritized clinical surveillance or monitoring of PFAS health effects. This assessment should characterize the likelihood of those health effects occurring given real-world human exposures and identify the human populations at most risk. Data or evidence gaps that contribute to uncertainty about health effects of most concern should be annotated. We'll also develop principles for clinical evaluation or biological testing given substantial scientific uncertainty about health effects or the value of such measures in informing care. These principles should address reasons for testing, when to test, who to test, how to test, what to test for, risks of testing, and the related social and ethical implications of testing. We'll also review the current knowledge about the contribution of PFAS exposure sources to human exposure and develop principles clinicians can use to advise patients on exposure reduction. Then we'll assess whether changes should be made to CDC ATSDR's clinical guidance or make recommendations on PFAS blood or urine testing, whether those are needed, given the committee's general principles and the assessment of the association between PFAS exposure and clinically relevant health outcomes. Ultimately, the goal is to provide guidance on how clinicians can advise patients on PFAS testing and health outcomes that may be associated with PFAS, as well as to advise patients regarding standard medical or preventive care and exposure reduction. Then finally, the committee will outline a process by which CDC ATSDR can effectively review and update the clinical guidance over the next decade. So given all of that, what are the things that the study won't do? We won't be setting a national drinking water standard for PFAS. We won't be proposing strategies for regulating PFAS. We won't be discussing strategies for cleanup, disposal, or removal of PFAS, and we won't be suggesting replacement chemicals for PFAS. As stakeholders, you might also be interested in the project timeline. This study began in September of 2020, where we announced a call for nominations, and then we began to vet and approve committee members. And so now we've moved into the information gathering phase of the study, where we're holding meetings, reviewing literature, commissioning white papers, and we've been gathering other information from stakeholders. And so we're gathering a lot of the information from stakeholders through these town halls, the first of which is April 7th, the second is May 6th, and the third is May 25th. We'll also have other information gathering meetings July 13th through 15th and August 11th and 12th. And the information gathering sessions inform the preparation of the committee's report. So the committee is also, that phase of the study has also started. So right now the committee is determining their approach to the statement of task and assembling and critiquing the data. Soon we'll start developing and debating conclusions and recommendations, and then we'll prepare the report and where it will go into peer review. And that's when the study is in really like a quiet phase, where you'll not hear as much from the committee you won't hear as much about the study publicly at that point in time. But then finally, after the report is approved by the National Academies for release to the public, then it'll be disseminated and the project will end in May 2022. So here is our committee. You recently just met our chair, Ned Kalange, but then also the committee is made up of experts in a variety of different backgrounds. We have clinicians, we have several clinicians, we have several toxicologists, and also environmental epidemiologists and exposure scientists. And then we also have people with expertise in risk assessment and risk management, as well as environmental ethics and philosophy of science. And so it's important to know that the committee has to be, a National Academies committee has to be constituted to objectively and fairly review the evidence and to be able to make a recommendation that is considered, unbiased and based on the evidence that the committee has reviewed. So the committee has been, it takes a while to assemble a committee and constitute that they are free from, that their biases are balanced and the committee is free from conflicts of interest. And so that's the end of this intro presentation. But if you have other questions about the study, you can feel free to go to our study website, or you can contact me and my emails here on this slide. It's eboyle@nas.edu. Do you have anything else you'd like to add, Ned?
No, I really appreciate the opportunity to participate in the study. And Elizabeth, I appreciate how great a job you did in outlining the statement of task and the timeline and other issues. And we look forward to gathering information in the town halls and working together on this important study.
Yeah. Thanks for watching.